Have you ever felt stuck with your treatment? Or maybe you see other patients that progress, but your pain doesn't want to go away? So basically, what is wrong with me? Let's talk today about something I see very often in my practice. Chronic pain patients who receive good care, follow their exercise, try different therapies, and yet the relief is only temporary. Hi, I'm Kasia, founder of Physio by K. I help patients understand their body and chronic pain beyond symptoms. And I help medical professionals rethink physiotherapy by exploring fascia as a central functional system through fascial manipulation by Stecco. In chronic pain, the painful area is often not the original source of the problem, but a secondary result of long-term compensation. Let me give you a real example from my practice. I had a 46-year-old man who came to me with lower back pain lasting already several months. The pain started when he was placing his newborn baby into a cradle. You'd think that's a pretty simple maneuver, shouldn't cause much pain. But at that moment, his back seized up and he couldn't move for days. So he had physiotherapy focused on his lower back and exercises. He improved enough to return to work, but the pain never fully disappeared. And in his own words, it felt like his back is gonna snap at any moment. When we looked deeper into his history, he remembered a severe ankle sprain over 20 years earlier, with ligament rupture and long immobilization. Over the time, this has created rigidity and altered load transmission through the fascial system. You can see everything really well explained in the video somewhere around me, thanks to my colleague. So eventually, the compensation reached a weaker segment, which was his lower back. Treating the ankle only with actually one point restored balance and his back pain resolved fully. So overall, the back was not the primary problem. The back was never an issue because it was just the end point coming from the ankle from before 20 years. Many people suffering from chronic pain have already seen several practitioners, physiotherapists, osteopaths, doctors. They've done exercise programs, tried manual therapy, sometimes even taken really strong painkillers. And often the pain improves for a short time, but then it always comes back. At some point, patients start asking themselves, why is this not working for me? Why do others get better and I don't? What is wrong with me? On the other side, therapists feel frustrated too, trust me. Because most patients improve, but there's a group that stays stuck despite doing everything right, following all the protocols. That's usually the moment when we should stop and ask, are we missing something? When someone comes in with pain, it's pretty natural to focus on the painful area. Shoulder pain, we treat the shoulder. Lower back pain, we treat the back. And in many cases, this works very well, especially in acute injuries. So after a trauma, after a surgery or a clear injury, the local treatment and exercises support the natural healing process, help restore movement and prevent future complications. This approach is logical and effective, but in the right phase. So now let's talk about those phases. In here you will have a table with the division and all the explanations, so you have a visual aid. Based on healing timelines, pain can be divided into acute, subacute, and chronic phases. Acute pain usually lasts up to around 6 weeks and is linked to tissue healing and inflammation. Subacute pain may persist beyond that, but should gradually improve. And then chronic pain is usually defined as symptoms lasting longer than 3 months. And in those chronic cases, the problem is often no longer just local tissue damage. Because over time, the body adapts, avoids painful movements, and creates compensations. And at that point, applying the same logic as for an acute injury often doesn't lead to lasting results. Guys, this is not a video against exercise or against local treatment, because both are super essential. The key question in chronic pain is timing and clinical reasoning. In many chronic cases, starting with intensive exercise before restoring tissue adaptability can reinforce compensatory patterns. In easy words, if the tension is in here and the tissue damage is in here, if I ask my patient to constantly lift his arm as part of the exercise to the side, but he has pulling in the front of his shoulder, then he might compensate even in a tiny bit, and then he will be rotating, or he will be moving his shoulder more to the front and reinforcing this tissue that is damaged. This is why manual therapy aimed at improving fascial gliding and reducing pathological tension often creates better conditions for movement. If I treat that, or if I treat the tension coming from somewhere else that is creating this stiffness, the patient can freely perform the movement. Once this balance is restored, exercise becomes crucial to rebuild strength, coordination, and prevent recurrence. Research in chronic low back pain shows altered activation and reduced endurance of the paraspinal muscles, which is why exercise remains essential, but at the right moment. Manual therapy first, exercise later, when the tissue and the muscles are healthy and able to move in a proper way. Chronic pain requires broader thinking. When local treatment doesn't lead to lasting results, repeating it over and over again is rarely the answer. Asking better questions, understanding the patient's history, and looking at the body as an integrated system can completely change outcomes. This perspective doesn't replace traditional physiotherapy, it refines it. If you'd like to read the full article or see more videos like this, you'll find them on my website www.physiobyk.com. Thank you very much for watching.